Hello, and welcome to your interview day at Harbor-UCLA. I'm one of the chief residents at Harbor-UCLA Medical Center, and I'll be going over some of the basics of our program. We are really excited to host you for our virtual interview day. Hopefully this video helps you to get to know us a bit better. First, the mission of Harbor-UCLA is to provide high-quality, cost-effective, patient-centered care through leadership in medical practice, education, and research. Services are provided through an integrated healthcare system to residents of Los Angeles County regardless of ability to pay. We are the main county hospital serving the South Bay of Los Angeles. Our hospital is a 570-bed public teaching hospital that also serves as a Level 1 trauma center and a semi-receiving center. The hospital campus is currently undergoing a massive renovation, which should be fully completed by 2028. Our new outpatient building is on schedule to be completed in 2026. A total of 9 subspecialty fellowships are represented at Harbor-UCLA. We have in-house fellowships for cardiology, pulmonary critical care, hematology oncology, nephrology, endocrinology, and infectious disease. We also serve as a UCLA Ronald Reagan affiliated fellowship site for GI, geriatrics, and rheumatology. Dr. Alex Lee is one of our general internal medicine faculty and is our program director. Dr. Velasquez is an associate program director and is a general cardiologist with an emphasis in echocardiography. Dr. Pham is our other associate program director and is a hospitalist here at Harbor. Not only is our leadership passionate about serving our patients, but they also care about our residents' education and well-being. Regarding scheduling, we follow a modified X plus Y system, 4 weeks of inpatient followed by 4 weeks of outpatient. You do not have clinic while on inpatient services. In general, the first year is largely spent on medicine wards, ICU, and primary care rotations. The second and third year grant our residents much more subspecialty rotations, including Cedars-Sinai heart failure and transplant service, and an expanded outpatient experience, including 1 month in a Kaiser ambulatory setting. Each year involves 4 to 6 weeks of elective, plus 4 weeks of vacation in 2 2-week blocks. Notably, as a categorical intern, you will not take any 28-hour calls, as we have a night float system for all of our medicine services. As a second and third year resident, you will have about 6 total 28-hour calls per year to cover ICU services on the weekend. Here's a snapshot of the schedule for our wards and patient medicine teams. We have 6 medicine teams, and a modified DRIP and wards teams admit every other day. On early admit days, you admit from 7 a.m. until 4 p.m. We also have late admit days about once a week where we admit until 8 p.m. Your team can take up to 8 newly admitted patients on any admitting day, with a total team cap of 20 patients. Each intern is able to admit 4 patients in a day. You will have 1 day off during the week, typically on a Friday or a Saturday. Our attendings are very supportive, available, and approachable for our inpatient teams and rotate on wards for 1 to 2 weeks at a time. We also have support on wards in the form of a social worker and a utilization review nurse assigned to each team that will round with you daily to help with patient needs and discharges. We have structured academic curriculum scheduled throughout the year that consists of grand rounds, morning report, M&M conference, protected didactic time, and simulation sessions. We also encourage informal teaching from residents and attendings in the afternoons on wards and ICU services. Grand rounds are scheduled every Tuesday by Harbor-UCLA faculty with nationally and internationally distinguished guest speakers. We have protected curriculum time on Tuesdays from 1 to 4 p.m. designed to follow the ABIM board exam blueprints. The sessions are taught by faculty and fellows from the Department of Medicine. Morning reports are 45-minute case presentations held on Wednesdays, Thursdays, and Fridays, and they are moderated by the chief residents with faculty and resident participation. Here's an example of our weekly curriculum. All residents are protected to attend core curriculum each week from 1 to 2 p.m. Lectures after this alternate weeks. 1 week, interns will attend lectures from 2 to 4, and the next will be second and third year residents. We also have regular faculty-led sim training for core procedures that you will perform throughout the residency. The simulation curriculum also includes code blue simulations, advanced care planning, goals of care, and point of care ultrasound, which are designed to strengthen residents' clinical acumen. We have an interactive sim dummy where we can take residents through sample rapid medical responses and codes in order to sharpen clinical decision making. You will have 2 dedicated primary care clinic months during intern year, one during the first half of the year and the other in the second half. We also have a dedicated curriculum and mentorship for our outpatient medicine during these months. You will inherit your own primary care panel from a graduating resident. These patients will remain your patients for all 3 years. You will also be assigned a dedicated clinic attending who will help you with this panel. We pride ourselves on our residents taking ownership of their panel and forming relationships with their patients over their time here. Continuity is key to addressing health disparities. We make large efforts to ensure you are seeing your own patients when you are in clinic. This improves as you progress through your training and spend more time in clinic during your second and third years. From a research perspective, we share a campus with the Lundquist Institute, which is a world leader in biomedical research. Many of our clinical faculty also hold research positions with this institute and have grant funding. We expect our residents to publish abstracts, posters, or review articles in their first and second year. In addition, we expect our residents will publish at least one longitudinal project and present it as senior grant rounds by their third year. Incorporated into our curriculum are several sessions designed to help us reinforce research basics. We have conference funding available both through our program and through our union, CIR. After graduation, about 65% of our residents pursue fellowship and advanced training. We match people into competitive programs across all subspecialties, both locally in Southern California and nationally as well. The rest of the graduating class pursues careers as hospitalists or in primary care. Please refer to our website for further details on fellowship placements. Southern California is a great place to live and offers tremendous cultural diversity and exciting activities to enjoy outside of work. Here you can see the location of Harbor in Torrance, which is located in the South Bay. Our residents live all over the Los Angeles area. Some of the more popular cities include Redondo Beach, Hermosa Beach, Long Beach, and Torrance. This area features year-round excellent weather, beach and ocean activities, world-class music, art, television, and movies, national parks, and multiple mountain ranges for hiking and snow sports. Thanks for listening. You'll be having a Q&A panel with some of our residents during the interview day where you'll be able to ask any clarifying questions on our program. You can also always reach out to us at any point during your interview cycle with any questions or concerns. We look forward to meeting you.